And then, so I said cancer is sort of the first leading cause of death during this time, and then cardiovascular disease is the second. It's responsible for about 25% of deaths during this middle adulthood period. So a lot of people, know about like heart attacks and things like that. Some of the more silent killers are high blood pressure and cholesterol and atherosclerosis. Remember, that's the buildup of like fatty plaques inside the arteries. So the symptoms of cardiovascular disease include heart attack. If you suffer from a heart attack, that's a pretty good sign you may have cardiovascular disease. And a heart attack obviously is the most serious. Over half of the people who have a heart attack will die before they even get to the hospital, and then about 15% more die during the treatment of that, so very serious and severe condition to suffer from. In addition to that, arrhythmia is another symptom of cardiovascular disease. That's basically where you have a irregular rhythm to your heartbeat. Arrhythmia can result sometimes in faintness and can often result in blood clots, which can travel to the brain and cause strokes and other issues. Angina pectoris is basically chest pain. So if you have sort of a radiating pain in your chest, then that's another sign of cardiovascular disease. And just like with cancer, reducing heart attack risk pretty straightforward. You probably all know these. You should not smoke. If you do smoke, you should quit smoking. Reducing cholesterol through your diet. Treating high blood pressure if you have it, making sure you take the medications. Maintaining an ideal weight through diet and exercise. Kind of counter to what I was just saying earlier, it's actually helpful, it's been shown to be helpful to have occasional wine or beer. So drinking alcohol in excess can increase rates of certain cancers, but if you have just moderate amounts of wine or beer occasionally, then that can actually protect against cardiovascular disease. Taking low-dose aspirin, and then also reducing hostility and stress are all factors that can reduce the rates of cardiovascular disease and heart attacks. All right, and the last health issue I want to talk about during middle adulthood is osteoporosis. So again, it's normal, over the normal course of development, most people will have loss in bone density, but on the extreme end of that, you can develop osteoporosis, where you basically have very porous bones. So you have severe bone loss. The bones become very, very fragile to where, breaking them now becomes extremely easy. So normal aging can cause this. Also, heredity can contribute to the risk factor. So if you have a history of osteoporosis in your family, you're more likely to develop it yourself. Lifestyle also contributes. So having a poor diet, lack of physical activity, smoking, and excessive alcohol use all increase risks of osteoporosis. And then, just like I was talking about, women have more bone loss. They are also more likely to develop osteoporosis and to develop it earlier than men. So it's highly recommended that women, get adequate calcium in their diet. So one of the things you can do to prevent and treat osteoporosis is to have vitamin D and calcium in your diet. So if you don't, get those things through your diet normally, if you don't drink milk, maybe you're lactose intolerant, or you don't have other sources of calcium, then it's highly recommended to take a supplement, especially if you are female. Avoiding excess sodium and caffeine also has been shown to reduce risks of osteoporosis. And then weight-bearing and resistance training exercises can really help. There are certain medications that can help strengthen bones, and early prevention is really important to stop the disease from progressing further than it has to. All right, so multiple times with all of these, chronic diseases, I've talked about how exercise and diet are one of the things that can help. And I just want to also emphasize that exercise has been shown to have all kinds of other benefits besides preventing chronic diseases. So obviously it has physical benefits, but it has psychological benefits as well. Can help reduce stress, prevent anxiety and depression. Only 18% of people in middle adulthood engage in the recommended activity levels. So I think I talked previously about how it's recommended that you get, I think, 150 hours a week of cardiovascular exercise, and then at least 2 training sessions of resistance training. But very few people in this middle adulthood period tend to get that. Some of the barriers to beginning or continuing are lack of time. So obviously as you're entering this middle adulthood period, you've probably established a career. You may have children who are in their teenage years or going to college and you're dealing with that. You know, you have spouses and friends and all these other things to tend to, and so just finding the time to exercise can be really difficult. Also, you tend to have decreases in energy during middle adulthood through, you know, lots of these issues that we've talked about. You may have health issues. So if you have something like osteoporosis or other, you know, issues we've talked about, then you may be scared to exercise because you may be scared you're going to fall and hurt yourself. Then of course, you know, convenience, work, lack of facilities, etc. All these can contribute. Self-efficacy promotes exercise, so teaching people to view themselves as competent and capable of engaging in exercise has been shown to increase rates. And interventions are particularly important in low socioeconomic status adults because all of these issues are probably compounded. They may be working multiple jobs, they may have increased health issues, and they may have less, you know, access to facilities compared to someone of a high socioeconomic status. I guess the last thing too I want to emphasize is, again, huge variability in these issues. It's not like it's inevitable that as you get older you have to suffer from all of these things. If you do exercise and, you know, eat a healthy diet and take care of yourself, then it's pretty likely that you can have sustained health for a pretty long period of time throughout middle adulthood. So I don't want to sound all like doom and gloom about this time period.